Welcome to another edition of Grace Under Pressure, where my guest today is Dr. Helen Riess. I will tell you all about Dr. Riess in just a moment. LinkedIn Live, this show is all about posing questions to thought leaders and doers like Dr. Riess, who are making our world better. And grace is that ability to feel compassion, react with generosity, and a commitment toward others. And when you do it as a leader, it means mobilizing people for better actions and pulling the whole team together. Welcome, Dr. Riess. What an honor to have you on our program.
Thanks for having me.
Great. I want to tell everyone around you, Dr. Riess is a clinical psychiatrist and associate professor of psychiatry at Harvard Medical School and the director of the Empathy program at Massachusetts General Hospital. In 2012, Dr. Riess founded Empathetics, a company that provides evidence-based empathy and communication skills, training for healthcare, law enforcement, business, and education. Dr. Riess is internationally recognized speaker on the topic of empathy and emotional intelligence. Her TEDx talk, The Power of Empathy, has been viewed 600,000 times, folks. Yes, 600,000, okay? Her new book is The Empathy Effect, and she's going to talk to us about it. It's been licensed in 10 different countries and translated into at least 3 languages and counting: Korean, Polish, and Italian. Dr. Helen Riess and her team are dedicated to transforming organizational systems into compassionate care systems. And boy, do we need that. Dr. Riess is a practicing psychiatrist and on faculty at Harvard. A big welcome to you, Dr. Riess. Thank you.
Thank you for the nice introduction.
Great. You know, folks are under a great deal of pressure today. So what do they tell you they're worried about?
So today, first of all, people in general are always feeling that they're under pressure, but with the events that have taken place this past year, more people are worried about just staying healthy. You know, the risk of the pandemic is everywhere. People are worried about their jobs and their job security. Business owners are worried about whether their businesses are going to survive. Parents are worried about whether their children can get an education with homeschooling and all the challenges that that presents.
Right.
And I think in general, you know, people, their anxiety level is just at an all-time high right now.
Right. We had spoken briefly before that I know that clinical depression rates have increased, sadly. Am I correct in that?
Yes, I think one of the untold stories of the pandemic is the rise in mental illness. And by that, I don't mean, you know, severe, debilitating rise in schizophrenia or bipolar illness, but anxiety, depression, obsessive compulsive worrying. These are all really on the rise.
Right. Now, do you think, and because I think it relates to your topic and going down, will we be suffering a kind of PTSD when this is over, when we come out of it in a year or so, whenever that is? Do you and your colleagues think about or talk about that?
Well, I think we very likely will see some PTSD, post-traumatic stress disorder, but right now we're just seeing present-day stress disorder.
Yeah.
And I think that the post-trauma will evidence itself when people are reminded of what they've been through, or if you're a health worker, you know, having time to reflect on what's happened and noticing that maybe you're more reluctant to go to work or not as excited about your job as you used to be. Those are effects that we're already seeing.
And the negative effect, of course, is burnout. Am I correct in that?
Yes, we're very, very concerned about burnout because, as you and your listeners already know, burnout is a serious problem in healthcare, and adding this stress of the pandemic has not helped one bit. It's made it worse.
No, thank you. So that gives to a kind of amelioration, which one would say would be empathy. So some would say, or I'll say, that humans are predisposed to empathy. So why is it now we are less empathetic?
Well, empathy is it's a human trait that's actually responsible for us all being here, because without sensing and responding to other people's distress, we would be a very lonely planet. So it's definitely wired into the human brain. The problem, of course, now is that when people are facing many, many challenges to their own safety, their own sense of security, and their own, just peace of mind, empathy gets challenged because it's not in limitless supply, and it's a very mutable trait. So it has to be nurtured.
Right. And I think that's in line with some research I was privy to that are from the University of Michigan, which is my home school here, that said that empathy rates are dropping. Is it because of the pressures that we're feeling, or all of those things?
Yes, when people feel threatened, their attention gets drawn inward. And so when we're worried about our own survival, whether we're going to get sick, whether we're going to transmit it to our family members, there's less in the reservoir, so to speak, for outward empathy. And so it's really challenged right now.
Great. So, you are the author of a book. Can we see the title of that?
Yes, I have a copy of it right here. It's called The Empathy Effect.
Great. What led you to write that book?
Well, interestingly, already, I've been doing empathy research for the past 15 plus years. And it was really motivated by my listening to my own patients who talked about what it felt like when they went into, healthcare offices and felt that they weren't really being seen or heard. And I realized that this was having a profound impact on their motivation to make important changes, lifestyle changes.
Sure. How do you define empathy? Because I think some of our listeners, or I have ideas of it. So how do you define it?
So empathy, it's important to recognize that empathy is not one thing. It's a human capacity. It's like intelligence. There's not just one way to be intelligent.
And
empathy is, I think of it as a three-part kind of system where it requires perception of other people's suffering or mental states, processing that, and then that motivates a response. And so that motivation is called empathic concern. And so when we have our eyes open to the needs and suffering of others, our brains are wired to turn that perception into a feeling of concern. And so when everything's working correctly, that concern gets translated into acts of caring and compassion. So empathy is sort of the input, processing, and then compassion is the output.
Okay, thank you. And so, risk of being overly obvious, why is empathy so important for us now?
Well, if you talk to anyone who has been a COVID patient, who has only seen, this much of the caretakers' faces, they've not been allowed to see their relatives to get a hug, a squeeze of the hand, or reassuring words. We know that it's a profound impact on how they are doing in the hospital. And so it requires more intention now than ever to show empathy, to actually help people know how much you understand their loneliness and their suffering. And it's taking a lot of extra work because we're so covered up, both physically and emotionally.
Right. I was going to jump in and ask about the teaching of it, but I came across, and I will, but there was something, I had a guest on, Martin Lindstrom, who's a influential thinker in marketing. His newest book is The Ministry of Common Sense, which points out the issues that we don't act on with our common sense. Martin is Danish, And he says that today they are teaching pre-kindergartners empathy. Have you heard of that, or what's your perception of that, or perspective?
So I am familiar with his work, and I think it is excellent.
Yeah.
And, you know, a lot of my colleagues have said, why are you teaching empathy in medical school? These are skills that they should have learned in kindergarten. And
they are in Denmark.
Yes. And, you know, back when we were growing up, no one was explicitly teaching empathy, but it was hopefully modeled in the home. You know, there was more time for children back then, and it was considered part of child rearing to model caring for others, to teach children how to take the perspective of other children. Like, how do you think that made him feel, you know, when you took his toy or something like that? Right. And, you know, it's hard today with all these different pressures on parents, you know, to be taking on that role, and now also the teaching role and several others. But the early exposure to empathic thinking and empathic behavior, it can't be minimized. And I think we need all the help we can get to fortify the modeling that hopefully is happening at home with targeted education for preschoolers.
That's wonderful. And when you were mentioning medical students, and we will talk about that, I thought of my father, who was a physician and a family practice physician. And I always like to say that Dad's career he was mentored by doctors who didn't have a lot of tricks, I shouldn't say, didn't have who came of age in pre-antibiotics. So the bedside manner was very important to that generation, of course. And my father graduated medical school in 55 and then experienced all the great science, but he loved what he used to call it the art of medicine, which I think would be a form of empathy. Am I correct? That's
absolutely right. Yeah. There are more and more curricula now teaching the art of medicine, because, you know, the bedside manner used to be something we could take for granted, that people who wanted to come into medical professions would want to hear from patients, would naturally show care and concern. And we know that with the rush that medicine has become, of like people moving in and out of rooms at a quick pace, unfortunately, that is not being nurtured enough. Right. But there is a deep desire on the part of patients to have doctors who have a good bedside manner. And I think for most doctors to wish they had more time to express it.
True. There's a tremendous pressure on them with the reimbursement systems and all of that other stuff. So they have to, sadly, too often it's quantity, not quality. And I don't think few healthcare systems would admit it, but that's what happens at times. That's how patients sometimes feel. So, now, how do you, the basic question, how does one even begin to teach empathy?
Well, the good news is that many healthcare systems are recognizing that just having high throughput, high productivity is not resulting in patient satisfaction or good patient experience. Mm-hmm. And there are now a lot of metrics that are imposed on hospitals and medical groups to actually show what are patients saying about the care they're receiving. Not just did you get the antibiotic right, but did you show care and concern? Did your patient experience compassion? Did they feel respected and listened to? And so the fact that my company, Empathetics, exists is a testament to healthcare organizations reaching out to say, how do we, you know, really put these skills front and center again? And, you know, how do we remind practitioners to do simple things like greet the patient, make good eye contact, you know, sit at eye level with them instead of standing over. And, you know, making sure that patients understand what what we're talking about, not using language that they may not understand, but might feel a little sheepish about saying, I didn't really get what you just said. So, so it's really like having to have a refresher course in how do you comport yourself so that people know that you're fully present and really interested in them. Without that, you don't get much adherence to what you're asking people to do.
And I believe there's a link between positive clinical outcomes and empathy. Am I correct in that? I mean,
yes. My research group at Massachusetts General Hospital, we did a systematic review and a meta-analysis of all the studies that claimed that just by being more relational, like being more human, showing empathy, and actually using motivational interviewing to motivate people, to help tap into people's natural motivation, that just when they controlled for these human factors, people got better. They lost weight. They had fewer lung infections. There's a whole host of good outcomes, including meaningful impacts on diabetes and hypertension, which are, some of the most common healthcare problems that we face in this country.
And that's amazing when we think of that. That's by treating people respectfully, compassionately, it actually helps their well-being physically. That's pretty extraordinary. So
it is extraordinary, and we would probably be needing far fewer medicines if we could actually tap into people's intrinsic motivation to be healthy, instead of just telling them what to do. Like, honor what they're doing right, and then ask them, how much better would you like to feel?
So that I'll just leap then. So that there's an emphasis, of course, on wellness as opposed to sickness. That's where so much of family medicine is going on, wellness. So linked to empathy, that would be a greater, more positive clinical outcomes and fewer uses of therapeutics. Am I correct? So
yes, and right. Fewer uses of, pain pills and all kinds of things that people are just grasping for to feel better, but right. To feel that you really matter to somebody and that your health is of concern to somebody else is a chief ingredient and a chief component of empathy.
Well, we, as you know better than all of us, we have a serious opioid crisis, which is out of control. But is a treatment for opioids involve a degree of empathy as well? So.
Oh, absolutely. I mean, the whole conversation about how we even talk about people who have a substance use disorder is changing from shaming language like drug addict and, all kinds of negative terms, to realizing that people who get into trouble with opioids, they have an illness, because not every brain reacts to exposure to opioids by wanting more and more. Some brains just, they feel less pain and they're fine with it. But to blame people for getting into trouble is a total lack of empathy. Right. And to realize they don't want to be, dependent on these medicines, but until they find a way out, that's all they have.
So do you ever, as a health practitioner, do you talk to your colleagues about maybe substituting something else for opioids? Because, if we go in for surgery or whatever, we don't want to have the pain, but we don't want to become addicted either. So is there a midway point there? So
absolutely. I actually wrote an article for Medscape about the use of empathy in alternative treatments to substitute things that really help people relax, like non-chemical types of treatments like meditation, yoga, and really finding some relief in things that people can do to manage their own perception of their pain. And that requires, a practitioner who's not judging and shaming and blaming the patient, but really trying to tap into really good alternatives that unfortunately have not been talked about enough.
That's great. The other side of this, kind of on the negative, I do know with the malpractice, when if physicians are human, mistakes are made. Those physicians who acknowledge such a mistake, that very often a more positive outcome is achieved. Are you familiar with that kind of thing? So
absolutely, we actually work with many malpractice insurance companies because they, more than anyone else, understand how important the human component is in healthcare. I don't think any patient who's, rational could assume that no doctor is ever going to make a mistake. I mean, it's human, but it is how those mistakes are communicated, how much responsibility is taken for them, and maintaining, how do we make this the best we can for you, given that there's been a mistake, an honest and genuine attempt to ameliorate the harm. That goes such a long way, and it decreases the acrimony that can ensue when people become defensive or stop talking to their patients if they have suffered an adverse event.
No, your work in empathetics, I believe, would be originally dedicated toward or focused on the medical community, but you teach it in academia as well as business professionals, and most of the people who are watching this are business professionals. So if someone says to you, Dr. Riess, I want to get me some empathy for my people, what do I do?
Well, I guess the good news is that the empathy education is not that different depending on what profession you're in. Mm-hmm. A lot of it is about enhanced perception. Like, what is the person or what is the team in front of you? What is the emotional temperature here? And how do you gauge that? And how do you use your own body to know whether things are going well or, whether things feel a little off? So we teach a lot about paying attention to a lot of different kinds of signals instead of ignoring them or plowing through with your agenda, regardless of how people are responding to what you're talking about. So it's perception enhancement, number one. That's the first step.
Right. A lot of the folks I know watching this, because some of them, they represent the kind of people that I coach who are very successful and hard charging people and well-intended people. But one of the things they ignore is, and our research from Tasha Urich, who's a colleague, says that we lack in self-awareness. Now, a flip of that is, what about self-empathy? Does that play a role?
Well, yeah. So, John, self-empathy is the title of the last chapter in my book, because I wrote the whole book and then realized that we really need to treat ourselves with care and compassion. It's a way of sort of filling the tank. And if we don't take good care of ourselves, we're running on empty. Right. And, many people have said, I wish that were the first chapter. And in some ways, I think it would have been a good first chapter, especially given what people are going through with the pandemic. Right. But it was a final sort of parting shot with, if you don't learn how to take good care of yourself, the way you treat others is sort of a reflection of how you treat yourself.
Speaking bottom line, this analogy is used, and it's when there is turbulence in an aircraft, they say if you need a mask, put yours on before you need for the child. So that's what I like to think of, a certain amount of leadership. And if you're broken yourself, it's hard to be at your best for others. So.
That's right. And if even if you say, oh, take a vacation or take a break or don't work too hard, but people see you working constantly, they call that the hidden curriculum. That's really what they're learning, not so much what you say. And just a quick point, many people confuse self-empathy with being self-indulgent or selfish. We don't mean don't go to work and sit and watch television all day.
Isn't that what we're doing now? No.
No. How do you actually provide self-care where you calm down, where you just fill your mind with some positive thoughts or music or time with friends, or however you relax, or physical exercise? Because if we neglect those vital functions for ourselves, we don't model good behavior.
And I'm glad you mentioned that, because I think so much of it is, yes, people are adopting, especially the hard charging, successful people, they do overwork, and to a degree they like doing it. But in your point is you can't be at your best. If you're, I like to use this analogy that if you're working 120 hours after a while, you become impaired. And isn't there a likeness to being drinking, in the sense that a task that would take you an hour, if you've worked crazy hours, will take you 2 hours or worse? So.
Yes, there is a lot of data that shows that people who don't take breaks become much less efficient, less focused. And there's a real interesting napping data coming out, that people who take a 30-minute nap, actually they live much longer and their bodies have time to recover, because our brain cells need to recover. Our cells are constantly turning over, and that takes so much energy. So if we're trying to work like crazy at the same time that our cells are trying to replenish, it's like a double burden.
Absolutely. I love the napping. My grandfather, who worked multiple jobs, was a napper too. But one of my heroes is Winston Churchill, who very much took naps in the middle of the day. So that was important. But I think, so let me push you on the point of resistance. So I see you, or I'm an executive, and I say, Dr. Riess, I know what you're saying, but I'm a busy person. I've got to get these things done. What do you tell me? So
I would say, if you are a busy person and you have so much to get done, and what is in that question? Because you're saying this would be a big challenge because you have so much to do. So what part of you is actually asking that question? Is it a part that wants to do things differently? Because until the motivation comes from inside the person, if we tell them what to do, most people won't do it. People don't want to be told what to do.
Of course not. You need to change. I'm okay. But I think part of that is a matter of control. And I've seen this with folks. You don't get to be in a senior role without a degree of wanting to influence and control, and too much control is, but it's also the fact I need to do this. It becomes a trap, if you will. It's how you're measuring your self-worth, when in actuality, you're shorting yourself. Would you agree?
Right. You're measuring your self-worth by your work productivity, but you're not demonstrating your self-worth by how you're taking care of yourself.
Right.
And so I always look for maybe the little question, which is, I'm working so hard, I don't have time for this. What do you say to that? I just want to hear from the part that's curious, because if you really don't want to know anything, you just say, like, I have nothing to say to you. I'm good.
Right. Well, you're right. I flip it to, your people need you at your best. So.
Well, that is another external motivation that some people find really useful. I think people who are working, 80 to 100 hours a week, somewhere inside, they're seeking some permission to take a break.
And I'm glad you said that, because so often if you ask them, they may say, I can't do this. And then you say, are you happy? and they'll no, and that's where the change. Oh, you're the expert, not me. So, great. So I ask our guests a question or a moment of grace that they've observed or influenced. Do you have a story that you wanted to share with us? So,
you know, I do have a story. I was giving a talk on the East Coast when I got a message from my sister. My father had been ill for many years, and he had taken a sudden turn. And I got a message from her that said, "You need to get on the next plane. The doctors say, you know, Dad might not make it through the night." And I finished my talk. I got into an Uber, and I got the last seat on a plane to the West Coast. And, you know, I got there at midnight, and my sister said, we need to go to the hospital right now. So we went there, and my dad had very labored breathing.
yeah.
I held his hand, and I said a few words to him that I knew would mean something to him, even though he wasn't visibly conscious. And like within 20 minutes, he passed while I was holding his hand. And the nurse came in because she saw on the monitor that there was no heartbeat. And she said, "He was waiting for you."
Yeah.
And I hadn't formulated it that way, but that was such a gracious thing to say, because I was sort of breaking my neck to get there, and it took grace to even get the airplane seat. But for someone to acknowledge, you know, what that would mean for a daughter to have her father wait until she got there was, it's just a comment I really treasure.
And so often it's been said that it's that nurses are the extraordinary. And actually, the reason I wrote the book Grace, I pre-COVID played piano in hospitals, and I would see so many moments of grace by staff and nurses and physicians too. But nurses are very special. So what a wonderful and rich story. So thank you, Dr. Riess. How can we find you, and how can we know about your company?
Well, thank you. My company is called Empathetics. You can find it at empathetics.com. If people want to know a little bit more about how empathy works technically, and through some stories, you can visit my TED Talk, The Power of Empathy. And we didn't get to this, but my book is written for more than health professionals. It's written for parents. It's written for teachers, for business people. We are now working with police departments to help empathy, you know, in law enforcement. So the breadth of our work is ever expanding, and I just say it makes the world a better place. So if we can help you feel better in the world and be better in the world, we are here to help.
Great. Well, I will link to Empathetics in the notes for the video. Dr. Riess, it has been an honor to speak to you. Thank you for, I know you're extremely busy, for sharing your stories, and especially the one about grace and all the research that you take. You make it tactical and practical. So thank you.
Thank you. And those are really great questions. You know, for people to share grace in their lives, because I think these kind of stories are contagious.
There. Thank you.
Well, thank you for a nice interview.